Symptoms of rickets include osteoporosis, kyphosis, lordosis, scoliosis, bow legs, knock knees, beaded ribs, deformed chest or pigeon chest, distorted pelvis, delayed tooth eruption, pot belly, enlarged elongated flat head. There are two types of rickets. One due to low blood calcium levels and other due to low blood phosphorus levels. They are known as that is ricket due to low blood calcium level is called hypocalcemic ricket. The other due to low phosphorus level is called hypophosphatemic ricket. The hypocalcemic ricket is accompanied by tetany due to the abnormal fall in blood calcium level. Tetany means muscular contraction, that is muscle in a contracted state is called tetany. Then coming to osteomalacia, it is a ricket in adults. It's more common in women than men. It usually affects pregnant women in parda, that is those who do not get a sufficient sunlight and food which has enough vitamin D and calcium contents. It results from inadequate mineralization of bone tissues due to vitamin D deficiency. Decalcification of bones, that is drainage of calcium phosphate from bone, and osteoporosis are also contributing factors. Deficiency of vitamin D may either be due to inadequate intake or due to its insufficient intestinal absorption. It may be due to kidney disorders. Kidneys are concerned with the final processing and activation of vitamin D. Progressive decalcification makes the bone weak and strong, that is soft. This is more prominent in the spine, ribs, and girdles and legs. The clinical manifestation of osteomalacia include persistent skeletal pain, deformities of the rib, sacrum, lower lumbar vertebrae, pelvis, and legs, muscular weakness, difficulty even in climbing stairs, spontaneous fractures, etc. Avitaminosis and hypovitaminosis lead to disordered metabolism and impaired physiological functions. So all these are very various disorders of the caused by the deficiency of vitamins. Now coming to the different names of vitamins again, to summarize: vitamin A is called retinol, vitamin D is called calciferol, E is called tocopherol, K is phylloquinone, B1 is thiamine, B2 is riboflavin, B3 is niacin, B5 is pantothenic acid, B6 is pyridoxine, B7 is biotin, B9 is folic acid, B12 is cyanocobalamin, vitamin C is ascorbic acid. Now we can remember the name of the vitamins, like the Romans never painted pyramids before college. This is a mnemonic to remember the vitamin B complex. The is for thiamine, Romans indicate riboflavin, R indicates riboflavin, never, and N is niacin, P is for pantothenic acid, pyramid is for pyridoxine, before, you can remember both biotin and folic acid there, and college C resemble it is for reminding cyanocobalamin. So the Romans never painted pyramids before college will remind you of the different vitamin B complexes. Hypervitaminosis makes us hard. This HARD is a mnemonic to remember what are the symptoms of hypervitaminosis. Hypervitaminosis makes you hard means H is for headache, or hepatomegaly means enlargement of the liver. Then A stands for anorexia. Anorexia is loss of appetite. Alopecia means loss of hair. All these are symptoms of hypervitaminosis. Then R is for really painful bones. The E is missing there. So, and last one, D is for dry skin. So hypervitaminosis makes you hard means H is for headache and hepatomegaly, A is for anorexia or alopecia, R is for really painful bones, and D is for dry skin. So this is mnemonics which makes you remember vitamin B complex as well as hypervitaminosis symptoms easily. Now, the best breakfast that I would suggest for you, that is a South Indian breakfast of idli and sambar, is very rich, because one paper which I had read recently shows how this idli and sambar supplies enough nutrients to us. So here the rice in idli, you have 3:1 ratio. You put a 3 parboiled rice plus 1 urad dal in combination to grind, right? So in rice we have enough of the sulfur containing amino acids like methionine and cysteine, but there is a limiting amino acid, that is, rice has no lysine. Its lysine amount is very low. But pulses like urad dal or the sambar dal that we are using will have abundant lysine, which will compensate for the absence of it in rice. So, and pulses have very less of methionine, cysteine and tryptophan, which will be compensated with the cereal, rice. So, when you are using it in combination, all the essential nutrients will be got in one meal. So, and again, in this paper, it was found, while reading it, it was found that after fermentation in idli, that is in 3:1 ratio, thiamine level and riboflavin level is very high. Okay, and after 10 hours of fermentation, this idli will have folic acid around 0.75 milligrams per 100 mg, which is sufficient amount. It's a maximum value. So that is how idli and sambar is said to be the best breakfast compared to others. Similarly, when you check the backyard fruits of us, that is the jackfruit, it has plenty of benefits. One serving of jackfruit provides 133 kilocalories. Okay, it gives about 7% omega-3 fatty acids, 13% potassium, 5% of vitamin A, 21% of vitamin C, 12% of vitamin B1, calcium, fibers, iron, vitamin B6, and it is rich in antioxidants. So not only that the fruit is high in antioxidants, flavonoids and vitamins, then it is also used by all the vegans all over the world as a substitute for meat, because seeds are also edible. It can be roasted and boiled and eaten. So this is by which we end this topic of nutrition.